Mr. President-elect, Madam Vice President-elect, thank you for your trust and your confidence. I bring greetings and thanks also from my grandmother, Sarojini, my mother and father, Maitreyi and Vivek Murthy, from my sister Rashmi and brother-in-law Amit, and from my dear wife Alice, and my dear children, Tejas and Shanti. We thank you for this opportunity to serve. When I left my role as Surgeon General, I never dreamed I would have the opportunity to serve again. And in this moment of crisis, when so many Americans have fallen sick and lost loved ones, when people have lost their jobs and are struggling for childcare, I feel grateful to be able to do everything I can to end this pandemic. While this is a daunting task, we absolutely have as a country what we need to overcome this virus. We have world-class scientists. We have courageous medical professionals who are risking their lives to care for the ill. We have companies that are on the cusp of delivering vaccines. And most of all, we are blessed with generous and compassionate people all across America who are stepping up to help those who are struggling. If we work together, we will overcome this pandemic and return to our lives. But COVID-19 is not the only health crisis we face. If anything, it has underscored a host of other epidemics that are devastating families and shortening lifespans. Crises like addiction, including the opioid crisis, our aspiring mental health concerns, our glaring racial health disparities, and the high rates of chronic illness that we face, like diabetes and heart disease. These challenges are both caused by, but also exacerbated by, broader societal issues, from the economic strains so many people are facing, to the disconnection and loneliness that many of us feel. In my new expanded role, I will work to bring a health focus to our policies across government so that our schools, our workplaces, and our communities can be forces for strengthening our health and well-being. But the truth is that the very best policies, and even the best vaccines and treatments, will not heal our nation unless we also overcome the fear, anxiety, anger, and distrust that so many Americans are feeling right now. So more than anything, I will come to this role as a doctor, one who learned the most important lessons about medicine not in medical school, but from the clinic that my parents opened when they first came to America as immigrants decades ago. As a child, I saw how they took their time, not just to diagnose illnesses, but to ask their patients' families about their lives, to pore over pictures of children and grandchildren that were pulled from wallets. They listened deeply to people's stories and their struggles, often running well over their appointment time. And they taught me that the best doctor is not an authority figure who writes prescriptions, but rather a partner in healing. Someone who sees patients in their fullest humanity and empowers them to take charge of their health. That is the kind of doctor I have always tried to be. And if confirmed, that is the kind of Surgeon General that I will strive to be. I will dedicate myself to caring for every American, driven always by science and facts, by head and by heart, and endlessly grateful to serve one of the few countries in the world where the grandson of a poor farmer in India could be asked by the president-elect to look out for the health of an entire nation. That is a testament to the promise of America, one that I will seek to fulfill every day as Surgeon General. Thank you so much. And thank you again, Mr. President-elect and Madam Vice President-elect, for this opportunity to serve.